for the treatment of the cervical, dorsal and lumbar ratches. It enables the physiotherapist to perform traction, massage, thermotherapy and other types of physiotherapy simultaneously. External condyle, psias measurement. It consists of a height-adjustable tibial support with a graduated scale measuring the external femoral condyle psias. An anatomically shaped clamp for the perfect containment of the thorax with an axillary and brachial support with a biceps block and a hand support. Traction control. The bench has a dynamometer to measure and to constantly visualize the traction intensity throughout the treatment, as well as a padded central part with a large ventilation hole to support the pelvis and the thorax. Traditional massotherapy. The Massotraxen bench leaves a large space for the complete treatment of the ratches. The physiotherapist's working area is large, always accessible and open. The patient's relaxation during traction. Since the patient relaxes during the treatment, it is possible to increase the traction strength. The Massotrax integrated system completely eliminates the side effects of the traditional mechanical traction because, thanks to the exclusive fixing system, the traction is gradual, slow and progressive, and even constant throughout the treatment. It is only the Massotrax system to offer such a large working surface, thus combining traction with a relaxing massage and thermotherapy. Readjustment of the micrometric system. Before traction, the muscles can be warmed up with a massage, as well as with any form of exogenous thermotherapy. The region to be treated is free of any kind of blocking. Now the traction strength can be increased. Thanks to the relaxation of the muscles, it is less resistant to traction. Dorsal and lumbar ratches under traction. Observe the large working area thanks to the exclusive fixing system of the Massotraxen bench. During the same session, the traction intensity exerted upon the patient is modified at least twice. It is not strange that the relaxation experienced by the patient fosters the absorption of the traction, enhancing thereby its effect. Preparation for the traction of the cervical ratches area. For the cervical ratches Massotraxen, a harness is used, to which a wheel is attached, regulating the movement of the traction rope. Occiput, chin positioning, starting the cervical traction with sandbags. The rope connects a classical occiput, chin webbing to the counterweights, sandbags. Diathermy treatment in the dorsal cervical region. The relaxing massage can be combined with all forms of thermotherapy and ultrasonic therapy. Diathermy treatment in the lumbar dorsal region. The relaxing massage can be combined with all forms of thermotherapy and ultrasonic therapy. Furthermore, laser therapy can also be applied. The final stage of the treatment. It requires some attention. The ratches of the patient has been in a structural condition of diastasis for about 30 minutes, which is diametrically opposed to the orthostatic anti-gravity physiological position. Therefore, the patient is to learn to load the ratches gradually and to return to a correct erect position. Unblocking lower limbs. To offer better support for the legs while the patient is getting up, it is advisable to raise the tibial support. The patient is asked to use his or her arms to get up, sparing the trunk and supporting muscles affected by the traction as much as possible. In everyday practice, it can be observed that in an average of 30 minutes, thanks to the versatility of the Massotrax integrated system, the patient can benefit from the effects of 3 treatments, while